Even though it's been months since I had COVID, I feel like I still have it. What are your symptoms? Shortness of breath? Coughing? Chest pain? I feel the same symptoms that I felt back when I got COVID 3 months ago, like shortness of breath and loss of smell, but I seem to have developed some new symptoms, including fatigue and memory loss. And even though I keep testing myself, the result is always negative. Well, that's because you have something known as long COVID. Let me and my colleagues explain it to you. To fully understand long COVID, we need to learn about the history of COVID. As you already know, COVID, aka coronavirus, aka SARS-CoV 2, is a type of virus that has caused a global pandemic widespread of respiratory illness called COVID-19. Coronavirus spreads through virus particles and droplets released into the air when an infected person breathes, sings, talks, laughs, or even coughs. Larger droplets may fall to the ground in a couple of seconds, but smaller virus particles linger in the air and can accumulate in enclosed spaces, especially when there is a large gathering of people in one place with a poor ventilating system. The first case of COVID 19 was reported on December 1st, 2019, and was caused by the new virus SARS CoV 2. It is hypothesized that the virus originated in an animal and changed so that it can cause illness in humans. However, the definitive cause of COVID 19 has not been discovered, and research studies are currently being conducted to reveal the origin of this disease. Although vaccinations have been developed to help individuals fight against the virus, some people who are infected by the virus still experience both psychological and physical symptoms for more than 12 weeks. When this happens, it is known as post COVID 19 conditions or long COVID. Long COVID is not the same as COVID 19. The symptoms of long COVID are different from symptoms experienced during the initial infection and are rather long term effects people experience after their COVID infection. What are the symptoms?
So long COVID can affect almost all of your organ systems, including your heart, kidneys, brain, respiratory system, digestive system, and even skin and hair. Since symptoms can be ongoing, returning, or completely new and separate from those you had while you had COVID, diagnosis can be difficult. The World Health Organization, or WHO, has now come to define long COVID, or post COVID 19 condition, as the continuation or development of new symptoms that occurs in individuals with a history of probable or confirmed SARS CoV 2 infection, usually 3 months after the initial onset of COVID 19, with these new or continued symptoms lasting for at least 2 months and cannot be explained by an alternative diagnosis. The Canadian government's definition is 12 weeks rather than 3 months, but the idea is essentially the same. The most commonly reported symptoms include fatigue, difficulty concentrating, memory impairments, shortness of breath, and muscle aches. However, the full list of symptoms is quite long, with over 200 symptoms ranging from heart palpitations to diarrhea to brain fog to persistent coughing. Severe symptoms include an increased heart rate, chest pain, breathing issues, and even various neurological dysfunctions. In some cases, COVID has even been implicated in the development of type 2 diabetic symptoms.
But what causes long COVID? Unfortunately, the exact cause of long COVID is not yet known because people can develop any symptoms at any point in time, affecting different organ systems each time. However, scientists have come up with some possible theories. These theories include micro blood clots, which were observed in the lungs of a few children after they got COVID-19. Coronavirus persistence, which is when the virus lingers in the bodily tissues even after one has recovered. And persisting immune response, which basically means that the immune system of the patients with long COVID were constantly in high alert or attack mode for up to 8 months after testing positive for the first time. It's important to note that these are simply just theories and that there's no proven link between those theories and long COVID. Scientists are still continuing their research. But who has the highest risk of developing long COVID? You are most at risk if you have experienced COVID-19 symptoms severe enough to cause hospitalization or if you needed intensive care while recovering from COVID. You're also more at risk if you had underlying health conditions prior to COVID-19. With that being said, long COVID is also seen in patients who did not even have symptoms when they got COVID-19 or had extremely mild symptoms. In fact, a study reported in Italy showed over 87% of recovered COVID-19 patients experienced at least one persisting symptom for longer than 2 months. Of all those people, over 55% had more than 3 symptoms last for longer than 2 months.
How long is this going to last?
Patients experiencing long COVID can be divided into two subgroups. Group 1 is when their symptoms last over 3 weeks, but under 12. And Group 2 is when their symptoms last over 12 weeks.
Well, what should I do now? Is there a treatment for this?
Unfortunately, there's no single treatment available that can be prescribed for long COVID, but we can try to relieve your symptoms, depending on what they are. For example, beta blockers can be prescribed for those with increased heart rates, as well as general treatments including breathing exercises and physical therapy can also be prescribed. With that being said, a prevention measure everyone can take is getting vaccinated to prevent getting infected with COVID in the first place. Thanks for coming in and learning more about long COVID. If you have any other questions or the symptoms get worse, please give us a visit once again. I hope to see you next time. Bye-bye.